Hello, Assalamu alaikum. In this video, we will understand about the vertigo. What is the vertigo? We will understand in this video the peripheral and central vertigo. So, we will understand what is the vertigo and how it can occur. So, we will get the approach of the vertigo. The vertigo or dizziness is the complication with balance due to ear or brain disorder. In this way, the sensation of movements and horizontal spinning is involved, associated with nausea, vomiting, and the sweating due to the dizziness and generally feeling unwell. So the vertigo is the basically ear problem or brain problem, and it occur, and in this way we will not balance properly. That is why the vertigo, the meaning of the imbalance of the posture. Anyway, this is the person which that contain ear. We will understand about the right ear, and this ear contain a three part. The three part of the ear is the outer, middle and inner. In this way, this is the ear, and whenever the sound will arrive in the tympanic membrane is known as eardrum. The ossicles, stapes malleus and incus, that is the smaller bone throughout the body, which that will be give the vibration to give the signal to the cochlea, and these bones will vibrate due to the eardrum. These bones will move. This is the cochlea, and this is the eustachian tube which that balance the pressure, and this semicircular canal is used for the balance. This is the outer, middle and inner ear. But the balance is involved the inner ear, remember. This is the nerve, two type of nerves, auditory nerve and vestibular nerve is involved. Auditory nerve is used for the sound identification, while the vestibular nerve involved for the balance. Due to the semicircular canal are present, which that involve the balancing. In this way, the vertigo, which that is the due to the head injury, the ear infection, as well as post-surgical process and prolonged bed rest, which that also cause the vertigo. But anyhow, this is the semicircular canal bind with the cochlea, and this three semicircular canal is used for the balance. So this is the inner ear part. This semicircular canal contain endolymph, and this is the detection of the movement of endolymph through round window and oval window. Round window and oval window are lie vertically to each other, the 90-degree angle. This is the endolymph. Whenever the endolymph will move, the vestibular nerve, which that bound with the round window and oval window and inside is contained, we will understand also, which that is vestibular nerve transmit the signal toward the brain through a vestibular nucleus. We will discuss also. This is the round window and oval window contain hair cells. This hair cell is the sensory nerve fibers contain cells, and the upper part is the cupula or cupula. So it is cupula. This injury of semicircular canal will lead to cause also problem as well as labyrinthitis. Labyrinthitis. This is the common cold flu inflammation of labyrinth inside of the semicircular canal. Vestibuloneuronitis is the inflammation of the vestibular nerve. Meniere's disease and medication involved to trigger the vertigo. Let's understand about the pathophysiological aspect briefly. The sensory input is the vision, vestibular system, and proprioception in the joint, which that is involving the balance. So remember that things, the vision, the proprioception, and the vestibular system. The vestibular system used for the balance, while the proprioception will give the response from the brain to efferent nerves, while the vision from the perception from afferent nerve is the basically optic nerve. This is the cross section of brain, midbrain, and the pons and medulla. This is the medial longitudinal fascicles, and this is the vestibular ganglion. This vestibular ganglion, and this is the vestibular nuclei. In this way, here is you can see this is again I am drawing the hair cells, sensory nerve fibers. In this way, it's contain sensory nerve fibers, and the capillary damage if can cause also vertigo because the no balance reflex and hair cells damage by metaplasia or the tumor formation. In this way, here is the vestibular nuclei which the pass the vestibular nerve toward the medial longitudinal fascicles, and in this way the thalamus toward the site of where the balance is required. The vestibular nerve is anterior and a lateral vestibular and vestibular spinal tract is the afferent nerve. This vestibular nerve damage due to multiple sclerosis, autoimmune disorder and injury or aging. Anyhow, after this detection, the afferent nerve will move toward from the thalamus to the higher brain cortex. After the interneuron will transmit the signal back toward the muscle where the requirement for the balance, the contraction or relaxation of the muscle for balancing of the body if you are standing without any support. So the motor nerves, efferent nerve, will use for the neuromuscular junction to depolarization and balance. Anyhow, let's understand about the type of the vertigo, central vertigo and peripheral vertigo. So let's talk about the central vertigo. The central vertigo is targeting the different manners, like it will target the brain and spinal cord. The central vertigo is the number one thing is that the posterior circulation, the blood circulation will problem, the infarction will lead to even stroke. The posterior circulation infarction and stroke will lead to cause vertigo. On the other hand, the cerebellum problem. The multiple sclerosis is another way. In this way, the brain and spinal cord neurodegenerative process. This multiple sclerosis is the cause and syndrome which that prolonged. The tumorigenesis is the tumor formation of the brain which that also lead to associated symptom like the cerebellum and brain stem involving will lead to dysfunction. On the other hand, we will also learn about the posterior circulation infarction and stroke will lead to cause many complications. But in this way, the vestibular migraines mean the severe headaches that's usually felt as a throbbing pain at one side of head. This is due to the semicircular canal injury or the inflammation like the viral inflammation, remember that things. So in this way here you can see, so this is a severe headaches that's usually felt as a throbbing pain at one side of head. The posterior circulation infarction or stroke will lead to cause the symptom and sign, the ataxia, diplopia, and the cranial nerve defects, as well as limb weakness. Let's talk about the peripheral vertigo. This is the inner ear which does contain a cochlea and semicircular canal. The vestibular causes is the vestibule, the semicircular canal. The vestibule will be affected. In this way, it will lead to benign proximal positional vertigo, or BPPV, a Meniere's disease. It is the endolymph our production and the vestibular neuronitis. The vestibular neuronitis is a vestibular nerve inflammation. The viral infection, head trauma, aging, and idiopathic will lead to cause a disruption of the crystals, and calcium carbonate is known as the otoconia. In this way, this will lead to cause many complications, like the flow of the endolymph will not allow to move, and thickness of the endolymph will not move the crystals. Displays into canals trigger the symptom by movement and last 1 minute, occur over several weeks, and can recover again. But the attack of the Meniere's disease is the endolymph increase will lead to hearing loss, tinnitus, and the vertigo and fullness. Viral infection, the fullness of the endolymph, and the viral infection is the vestibular neuronitis, and the vestibular nerve inflammation will lead to acute onset of vertigo and last several weeks. I hope you make sense about this. This video was about the vertigo, peripheral and central. Thanks for watching. If you like my video, please make sure to subscribe, like, and share. See you in the next video. For this time, bye.